Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc, and today we're going to talk about the three most common causes of forefoot pain. They are metatarsalgia or capsulitis, callus formation, or neuroma. The big gorilla in the room, the one that causes most of the problems, is a capsulitis, and this is usually secondary to another deformity such as a bunion, limited motion in the great toe joint, a hammer toe, a Morton's toe, which is a long second toe, or a floating toe. And I've got a great article about this on my webpage. Typically it feels like a rock when you're walking on it. It's most commonly located under the second metatarsal, but when you're walking on it, it can feel like a very big generalized area. But when you start pushing on it, you'll find it's underneath the second toe or the second metatarsal. It will increase with activity. The more steps you do, the more it gets agitated. It's aggravated by dress shoes, thin-soled shoes, or high heels. It reoccurs and it usually is escalating associated with activity. And the big warning with this one, if it gets to be chronic and stays there for a long time, that can lead to a stress fracture, and that's a significant problem that is a lot longer to heal. Number 2 on the hit parade is callus formation. Now the body produces callus not as a whim but as a protective mechanism. There's a reason why it does that. As a result of pressure and friction, and most likely this is related to biomechanics or a deformity. This is also the body's way of telling you that the skin is going to fail. It increases with activity. The more the callus thickens, the more symptoms it's going to give you until you finally pay attention to that. The big warning with this one, the big danger is if we start to have decreased blood supply or sensation, then the callus will eventually turn into an ulcer, and that's a significant problem that can end you up in the hospital. It's very common for people that have this problem to come to my office and tell me that, oh, I think I've stepped on something. It's a piece of glass or a splinter. In essence, it's really the callus formation, because the longer it's there, the more it's shaped like a pyramid and creates kind of a pointed sensation, and it's just the body's way of telling you to stop using it. Now, third is a neuroma. This is probably one of the most misdiagnosed forefoot problems there is. It's really rare in occurrences. The location that it occurs is really specific. It's between the third and fourth toes. The symptoms are very specific. It's going to feel as a tingling, kind of a numbness sensation, and eventually turn into a burning. It's almost intense as if somebody put a match between your toes. It can be intermittent, and it keeps escalating. The more scar tissue develops around the nerve, the more damage it is, the more symptoms it's going to provide. I have a great video on my webpage that tells the difference between a capsulitis and a neuroma. There'll be a link to it at the end of this video. There'll be an additional link to a video talking about how we treat forefoot deformities. So if you learned something, hit the like button, hit the subscribe button if you want to see more videos that will put you to sleep. If you want to find out more about foot and ankle problems, my website is gotofootdoc.com. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.